amiable welcome to everyone. This is our Allied Lecdem channel to enhance your knowledge. Today's topic is about coronary anatomy. Like all other tissues in the body, the heart muscle needs oxygen-rich blood to function. This oxygen-rich blood is supplied by the coronary arterial system. The coronary arterial system consists of the right and the left coronary arteries. These arteries branch from the aorta, rising immediately from the true cusp of the aortic valve. These arteries are unique in that they fill during diastole when not occluded by valve cups and when not squeezed by myocardial contraction. These coronary arteries are known as the first branch of the aorta. We know that the aortic valve has three cusps: the right coronary cusp, the left coronary cusp, and the non-coronary cusps. The right coronary cusp gives rise to the right coronary artery, and the left one gives rise to the left coronary artery. In this picture, we can see the origin of both the arteries along with their branches, which are going to be discussed in the upcoming slides. Right coronary artery. The RCA arises from the right coronary sinus and courses throughout the right side of the AV group, giving off vessels that supply the right atrium and the right ventricle. These vessels usually continue as the posterior descending artery, which runs in the posterior intraventricular groove and supplies the posterior part of the IVS and the posterior LV wall. This RCA supplies the majority of the right heart. The branches of RCA include the SA node artery, the conus branch, the RV marginals, the AV nodal artery, the posterolateral branch, and the PTA. The supply of these branches are as follows. This RCA is being divided into three: the proximal RCA, the mid RCA, and the distal RCA. This proximal RCA branches off into the conus artery, which is found in 60% of the population and supplies the right ventricular outflow tract. The arterial branches that supply both the atrium along with the intra-atrial septum. The sinoatrial nodal artery, which supplies the SA node. The mid-RCA gives off the RV branch that supplies the RV free wall and the acute marginal arteries. The distal RCA gives off the atrioventricular nodal branch, which supplies the AV node. The posterior descending artery, which supplies the RV inferior wall, and the posterior septal perforators supply posterior 1/3 of the intraventricular septum, and the posterior LV branch, also known as a PLV, supplies the inferior wall of the LV. Since the RCA supplies the sinus node and AV node in about 60% and 90% of population respectively, therefore, disease in this artery may cause sinus bradycardia or AV nodal blocks. The left coronary artery. The LCA normally emerges from the left coronary sinus as the left main coronary artery. The left main coronary artery is short and passes to the left and posterior to the pulmonary trunk and bifurcates into the left anterior descending artery and the left circumflex artery. Sometimes this left main can trifurcate into LAD, L6 and the ramus intermedius artery. The LCA arises from the left coronary cusp, which branches into the LAD and L6. This LAD gets further branched into septals and diagonals, and this L6 branches into laterals or obtuse marginal branches. The left anterior descending artery. The LAD artery courses anterolaterally in the epicardial fat of the anterior intraventricular groove and supplies the majority of the left ventricle. The major branches of LAD are the diagonals and septal perforating arteries. The diagonal branches courses laterally and predominantly supply the LV free wall. The septal branches courses medially and supply the majority of the IVS as well as the AV bundle and the proximal bundle branch. Left circumflex artery. This LCX artery is the other major branch of the LCA. It courses in the left groove, giving rise to obtuse marginal branches, sometimes referred as lateral branches. This LCX artery and its branches supply the LV free wall and variable portions of the anterolateral papillary muscle. It variably gives rise to the posterolateral and the posterior descending artery branch supplies the diaphragmatic portion of the LV. The majority of the left ventricle is being supplied by the LCA, and any disease in this vessel can cause myocardial dysfunction such as infarction or bundle branch blocks. Collateral circulation, also known as alternative circulation. It is of two types, cardiac anastomosis and extracardiac anastomosis. Cardiac anastomosis is defined as there is a connection between the two coronary arteries present in the myocardium, that is, the two coronary arteries anastomose in the myocardial. Extracardiac anastomosis. The coronary arteries anastomose with the vasovasarum of the aorta, small blood vessels that supply the walls of the aorta. Vasovasarum of the pulmonary arteries. Internal thoracic arteries, which is also known as internal mammary arteries, which supply the anterior chest wall and the breast. The bronchial arteries, which supply high pressure oxygenated blood to the lungs and its supportive structures. The phrenic arteries that supply the abdomen and the diaphragmatic structures. These channels open up during emergencies when the coronary arteries are blocked or have got stenosed. Coronary dominance. The coronary dominance is determined by which artery supplies the PDA. If the PDA is supplied by the right coronary artery, then this circulation is classified as right dominant and is present in 80% of the population. If the PDA is being supplied by the LCX, then the circulation is termed as left dominant circulation. If the PDA is supplied by both the RCA and the LCX, then the coronary circulation can be classified as codominant circulation. Coronary venous flow occurs during both diastole and systole, and the coronary venous system drains the myocardium of oxygen depleted blood. This coronary venous system can be organized into two subgroups, the greater and the smaller cardiac venous systems. The greater cardiac venous system include the coronary sinus along with its tributaries as well as the anterior cardiac veins, and the smaller cardiac venous system is also known as the Thespesian venous system. Coronary sinus. This is the largest vein of the heart, which is situated in the left posterior coronary sulcus. It is about 3 cm long and ends by opening into the posterior wall of the right atrium. The tributaries of this coronary sinus include the great cardiac vein, which enters the left end of the coronary sinus, the middle cardiac vein. It accompanies the PDA and joins the right end of the coronary sinus. Small cardiac vein. It accompanies the RCA and joins the right end of the coronary sinus, the posterior vein of the LV. It runs on the diaphragmatic surface of the LV and ends in the middle of the coronary sinus. Oblique vein of LA. It runs on the posterior surface of the LV, joins at the left end of the coronary sinus, together develops as the left cardinal vein. The right marginal vein. It accompanies the marginal branches of the RCA. Anterior cardiac vein. It includes a 3 to 4 small veins running on the anterior wall of the RV, which directly opens into the right atrium. Vena cordis minimae, also known as the smallest cardiac vein or Thespesian veins. These are the numerous small veins present in all 4 chambers of the heart, which opens directly into their cavities. This Thespesian venous network is considered as alternate secondary pathway of the venous drainage of the myocardium. Here we have the diagrammatic representation of the veins of the heart. Here we can see the coronary sinus, which is known as the largest vein of the heart, and the oblique vein of the LA, which runs on the posterior surface of the LV, and the left marginal vein that accompanies the marginal branches of the RCA. The posterior vein of LV, it runs off the diaphragmatic surface of the LV and ends in the middle of the coronary sinus. The great cardiac vein, which enters at the left end of the coronary sinus, and the middle cardiac vein, which accompanies the PDA and joins the right end of the coronary sinus. And the small cardiac vein, which accompanies the RCA and joins the right end of the coronary sinus, and the anterior cardiac vein that runs on the anterior wall of the RV and opens directly into the right atrium. And now we are going to have a small recap about today's topic. The coronary arteries are of two types, the right coronary artery and the left coronary artery, which arises from the right and the left coronary sinuses. The RCA supplies the majority of the right heart and the posterior part of IVS and the posterior LV wall. The left main coronary artery gets divided into the left anterior descending artery and the left circumflex artery. The LAD gives off branches known as septal branches, which supply the IVS, AV bundle, and the proximal bundle branch, and the diagonal branch of LAD supplies the LV free wall. The LCX, along with its obtuse marginal branches, supply the LV free wall and gives rise to the PDA and the PLB. And the next is about collateral circulation, which occurs during emergency when there is a block or stenosis present in the coronary arteries. And the coronary dominance is determined by which artery supplies the PDA, and it is of three types: the right dominant circulation, the left dominant circulation, and the co-dominant circulation. And the venous drainage is by the coronary sinus along with the tributaries and the anterior cardiac vein and the Thespesian veins. Thank you.